Now, today's topic is education. It is a key pillar in founding a profession, and nursing and midwifery, as we know, are recognized as separate professions. Therefore, both will have shaped the education and science that is fundamental for their professional identity. Now, if we look back in history, it was the forming of the national associations that over the years actually strived to develop the related standards of education. But unfortunately, over the years, state and governmental bodies have taken the lead, and some of the countries, the associations have less of a role in setting the standards, educational standards. So today, we are going to hear from some of the great speakers who will describe the state of current nursing and midwifery education in the European region, with a final discussion on how we can together ensure that there is no deterioration of those standards and reach the priorities and indicators that are set in a roadmap. As we are facing plenty of challenges, both the pre and post-registration, it is time to act and make sure that the professions will have standards of education that will actually maintain our proficiency. Now, our moderator today is Dr. Karen Bureau, the chair of the organizing committee, and actually the webinars are organized by the EFN and WHO support, and EFN is for those, it's the European Federation of Nursing Associations, and WHO Euro is, of course, everybody knows. So not much more ado, I'm going to actually invite our other partner, representative Maggie Langins, the Nursing and Midwifery Policy Advisor for WHO Euro, to take the floor. Please.
Hi, Mervy, and hello, everyone. Thank you so much for being at this webinar. It brings me great joy that we are cooperating with EFNNMA and EFN on this series. It allows us to speak to you as associations about the key issues that need your attention and your members' guidance in developing. I want to share a few slides just to go through some of the fundamentals of how we see education as being one of the 4 key priorities for the strategic directions on nursing and midwifery. So I'll just share my slides here. And I will go through them quite quickly, but as always, I will share them with our EFNNMA colleagues so that they can also share them with you. So the key messages are that education is a policy priority. It's one of 4 of the global strategic directions on nursing and midwifery, but it is not separate and isolated from those. It's very tightly linked with leadership, with the scope of practice that you want, and the availability of resources to support a fit-for-purpose education. It has an impact in the quality of care and patient outcomes. There is a definition of nurse and midwife as defined by ISCO, and that should guide the required competencies of educators, but also the content of the programs. And WHO is active in this area, and that we do have some resources that are available. So here, just reminding you that there is, we do have the global strategic directions for nursing and midwifery, and the photo that seems to have disappeared from my slide is the roadmap for implementing those global strategic directions on nursing and midwifery in the European region. Now, for the first time in history, we have a resolution that goes with those global strategic directions on nursing and midwifery. Many of you know that we've had World Health Assembly resolutions, and we've had global strategic directions, but never have they been linked as they have during the World Health Assembly in 2020. The priorities in the global strategic directions emphasize that we need to align the levels of nursing and midwifery education with roles, the optimized roles, that it needs to ensure that the domestic production of midwives can surpass health system demand, so that when the health system needs to flex and change and adapt, that it can do so because it has fit for purpose nurses and midwives, and that education programs are designed to be competency-based, applied to effective learning design, and meet quality standards, but also that there needs to be due process and attention to the faculties, that they are properly trained in the best pedagogical methods. So here I'm just reminding us all of the Aiken study in 2014 in the Lancet that really shows how higher nursing education for nurses can reduce preventable hospital deaths, okay? So these, we don't have as clear data for primary health care, but we have a lot of evidence showing that improved quality education improves health outcomes. Now, who is a nurse and or midwife? We have the ISCO definitions here on the screen. And I think what I want to emphasize is that this definition says that nurses provide treatment, support, and care services for people, or midwives plan, manage, provide, and evaluate midwifery care services. And that the education that they get should allow them, when they graduate, to be part of research on their practices and procedures and be able to implement education activities in clinical and community settings. And that for nurses, that nurses like midwives can work autonomously or in teams with other health professionals. This is different from a nurse or midwife assistant who provides basic nursing and personal care and provides this advice to patients and families or monitors patient conditions upon being requested to do so by other health professionals like medical or nursing or other health professionals. So they're implementers, not initiators. This is what the State of the World's Nursing Midwifery report shows in terms of the duration of years. This is not to say one is better than the other, but it is to show that in our region, we have upwards from, the majority of our programs are 3 to 4 years long. In terms of midwifery, the State of the World's Midwifery report shows that the direct entry programs for midwifery are generally between 2 and 4 years. I'm not saying at this point one is better than the other, but certain criteria need to be met in those education programs. In terms of educator core competencies, here are some on the screen. So a sound understanding of contemporary educational theories and principles, the ability to design, implement, monitor, and manage curricula, to maintain current knowledge and skills in theory and practice, and to develop critical inquiry in their students, and the ability to conduct research and utilize findings, but also to have effective communication skills that promote collaborative teamwork, and that that educators in nursing curricula are able to demonstrate professionalism, including legal, ethical, and professional values that they can transfer to students, that allow students to, and that they use a variety of strategies to monitor and evaluate nursing programs, and are able to teach system management and leadership to create, maintain, and develop nursing midwifery programs. So that's from our Nurse Educators Core Competencies publication by WHO. Now, for the programs themselves, there are 3 pillars to nursing education, to theoretical instruction, and that is that there is basic science, but there's also nursing science. And on this screen, I have a list. I'm not going to go through it. And the 3rd pillar is social science. Now, in terms of clinical instruction, there is the emphasis on using different types of clinical instruction, so simulation, but also scenario. So not just using those dolls that so many people show me when I go to countries to assess education, but that they're also learning about scenarios and trying to apply that in a semi-real situation. And then that nursing students are also having nurse-to-patient interactions. This clinical instruction should be in a variety of areas, like specialist medicine, general and specialist medicine, maternity care, primary health care, also mental health, caring for older people, and general to specialist surgery. And that the pedagogy that is used to relay clinical instruction includes mentors during clinical practice, but also that systems are in place and agreements are in place between institutions and between education institutions and facilities to make sure that the experience is a good clinical experience. For midwifery, we also have general subjects. They're very similar to nursing instruction, but then there are a range of specific subjects that are very important for midwives. And this is why many countries choose to have different separate midwifery education programs. Now, in terms of practical training, there are a lot of requirements that have been put forward by the International Council of Midwives that have been linked to better performance as midwifery. And these are really important in the sense that students should have been able to advise pregnant women involving at least 100 prenatal examinations, or supervise and care for at least 40 pregnant women, and conduct at least 40 deliveries, 40 normal deliveries, but also that they're active participants with breech deliveries, and that they're able to perform and show that they can perform episiotomies and initiate suturing. But in terms of high risk, they should also have some familiarity with high risk pregnancies. And here there are some recommendations from the International Council of Midwives, but also Confederation of Midwives, but also published in the Lancet, that they supervise and care for 40 women at risk in pregnancy, and that they're able to observe and care for newborns that require specialist care. So there are a series of requirements, and because of time, I won't go through all of them, but these will be available in English and Russian to you. Now, in terms of ensuring success in quality education, it is a long journey. And as we will hear from the speakers today, there have been some countries that are really at different stages of education, and it's never a very quick solution. And I'm really glad to see that our colleagues from Kazakhstan will join us, because we've been working very closely with them to show that that process involves more than just the curricula development and putting a building in place and having students, but really that for quality education to be in place, it's important to secure up-to-date evidence and have research capacity and nursing and midwifery science developed, to develop the next generation of nursing and midwifery leaders that will, and that applies to you as associations, to develop those leaders to inspire and constantly improve education, that midwives and nurses are also able to work to their full extent. So there will be regulatory considerations, and also that we have the jobs where they can work. And finally, financial access for students and faculty. Further, there's also the demographic considerations. It's important to ensure that this quality education is available wherever you are learning. So if you're not learning in a big center, but you're learning in a rural area, or if you're a woman who has to interrupt your studies for other family requirements, or you're older or younger as a student, that you're able to continue your studies without major barriers. Financial reforms, geographical distribution of nursing and midwifery schools are extremely important, that they do not remain just in big centers and urban centers, and that curricula are harmonized across the country, so that you're not getting a different kind of education in a rural area than you are getting in a center. And finally, the continuous monitoring and evaluation of improvement. So my last slide is just to show that, and it's actually in Russian in this case, that we have some tools that are available. We have a wonderful tool to assess midwifery education developed by our collaborating center at Cardiff University, and we will hear Grace speak today. But we also have from Coimbra University and from the Finnish evidence-based institute HOTUS, 2 publications about how to ensure that education is promoting evidence-based practice and how to create fit-for-purpose simulation training. The picture on the left is just to show that we're working closely with Central Asian countries, Tajikistan, Kazakhstan, Kyrgyzstan, and Uzbekistan, to develop a roadmap for strengthening nursing and midwifery, and to emphasize that in these 4 countries, education has been a very big priority, and we will be actively involved with these countries in this regard. But yeah, thank you very much for your time. And again, I will share these slides as with EFNNMA for wider distribution. Thank you.
Thank you very much, Maggie Langens, and thank you for your leadership on development of the roadmap for nursing and midwifery in the European region. Part of the webinar and the purpose of the webinar series is really to raise awareness, and I think we can definitely say that implementation of the roadmap that you've just given us a very good rundown of really starts with awareness, because if we're not aware of what has been developed at the level of WHO Euro and also at the international level from Geneva, it would be very difficult to achieve anything. But by raising the level of awareness, especially with our national nurses and midwives associations, and indeed nurses across and midwives across the region, then we can really create a force for change. And this is where we want to go, because it's really important that nurses and midwives are able to be empowered and to be able to make our optimal contribution to universal health coverage through transformation of our health systems, and to really make our optimal contribution. So thank you very much for this excellent kickoff of our webinar today. Thank you. And now, just to move on, we have invited 4 speakers to the webinar today, and their presentations will be followed by a discussion on the role of the national nurses and midwives associations as key stakeholders for quality education. And I will ask our speakers to keep to their time, and I will remind you when you have about 5 minutes left of your presentation, and also when you have about 30 seconds left. So I believe that everyone is able to press the button for interpretation. We're very happy to have the support of WHO Euro office that is providing interpretation for us today. We have 2 interpreters with us online, and if you're having difficulty discovering how to access the interpretation, please do put that in the chat so that we can assist you. By the way, my name is Karen Bureau, and I'm chair of the organizing committee for the webinar series, and also I'm a board member of the European Forum of National Nurses and Midwives Associations for about the past 9 years. And also I am vice president of the International Council of Nurses, one of 3 representatives from the European region on the board. So, just to move on then, because we do have a very tight schedule today, our first speaker for the webinar series today is Grace Thomas. And Grace is director of the WHO Collaborating Center for Midwifery Development at Cardiff University in Wales. And she'll be speaking on the topic, Educating the Future Midwifery Workforce, Challenges and Opportunities. Please, Grace, you have the floor. Welcome.
Thank you very much, and good afternoon to you from Wales, Dobry Den. It really is a great honour for me to be with you this afternoon or this morning or even this evening in some countries, and to share some thoughts with you about midwifery education. I thought we could start maybe today to think about, so why is this important? And Maggie's already given us a really clear background and a real policy direction from WHO as well. But why is it important that we have skilled, educated midwives? Well, the evidence is absolutely clear out there that 300,000 women still die every year globally because of pregnancy-related reasons. And we know that, in fact, 90% of those deaths are preventable, and that quality midwifery care that is delivered by skilled, educated midwives can actually avert 4 out of 5 of those maternal deaths. So it's very clear from the evidence that midwifery is a best buy to improve maternal and infant health globally. However, that requires midwives who are able to work to the full scope of practice as outlined in the international definitions. And Maggie's already shared those definitions. And there's the International Confederation of Midwives definition that we can look at as well. And for midwives to work to full scope of practice, they need to be educated to an international level. I can just move on. Now, in the State of the World's Midwifery Report of 2021, there were some really clear key messages, and that showed that, in fact, there's a shortage globally of 900,000 midwives, and that we really need to be strengthening education and training, because this is key to address maternal and infant mortality, which varies, as we know, considerably across our European region. And this is something we need to be aware of and need to address. We know from this report that fully educated and licensed midwives, midwives who are regulated in their country and licensed to practice to the full scope and who work within interdisciplinary teams, can deliver about 90% of the essential sexual, reproductive and maternal health for newborns and adolescents as well. So investing in midwives facilitates positive birth experiences, but also safe and effective, comprehensive abortion services. Midwives can improve health outcomes, and it also favours inclusive and equitable growth within a country, facilitating economic stabilisation and a positive microeconomic impact. But however, in order to achieve this, we have to have some bold and urgent investment in every country. Now, in the WHO Global Strategic Directions for Nursing and Midwifery, which Maggie's already mentioned was endorsed by all member states at the World Health Assembly in 2022, there are 12 policy priorities, and they sit under these 4 pillars. And in the education, there are 4 key statements which talk about aligning levels of programs of education, about increasing graduate education for nurses and midwives, and also to ensure that the quality of programs is consistent, and that means that they are competency-based and that they are accredited. And also it's really important that we develop faculty, and that is faculty of nurses and midwives who can teach other nurses and midwives. So if we have all of this evidence, and we recognise that midwives who are educated to international evidence-based standards and can work to their full scope of profession, and that they can make a huge difference to global health, then why is it so difficult to implement? You know, if this was a wonder drug, a medicine that had been discovered that could cure a specific disease, I'm sure that every country and every government would be wanting to invest in it and buy it. So we now need to think of this as a real investment, and we need a call to action in every single country to look at the education of midwives. We recognise there are some challenges. So what are the challenges within our region? We know that across the Euro region, midwifery education and midwifery practice varies considerably in terms of the length of preparation and the level of preparation. It also varies in what midwives are allowed to do once they are qualified. And for many midwives in many countries, they still are having to practice under the remit of a doctor. And that is not what the evidence tells us. The evidence tells us that for midwives to be effective in reducing mortality, they need to be able to practice as a lead professional alongside their medical colleagues. So midwifery varies in terms of the status of midwives in the country and also this license to practice to the full scope. We also know that maternity care is not always evidence-based. It's not always women-centred, and it's not always compassionate and respectful. And this is something that we need to address. We know that midwifery education is often taught by doctors or nurses rather than by midwives. And there is often a lack of hands-on clinical education and instruction and skills for students in placement learning. We know that the length and credits devoted can vary, and the academic level varies between certificate, diploma, and bachelor level education. The other challenge mentioned by Maggie is that at the end of education, there must be jobs available for these graduates, for these newly qualified people to step into. We also have great opportunities, however, in the European region, and now is the time to act. We have political will across many, many countries in our region. I was extremely fortunate last week to be with Maggie in Tajikistan on a mission. And the president of the Republic of Tajikistan mentioned in his address the importance of educating nurses and midwives. So there is political will in many, many countries, and that's the opportunity we must seize. We have support from WHO, we have clear direction, we have standards. And we have the evidence base that having educated midwives will reduce maternal and infant mortality. We're also very fortunate that we have very clear frameworks, standards, and guidelines that are based on research evidence. And these are available to us all through the WHO, through the International Confederation of Midwives. And I'm also going to share some evidence-based standards from my own country through the Nursing and Midwifery Council. We've already heard that we're fortunate across our region to have the roadmap, the regional roadmap for implementation of the global strategic directions. And this gives us very clear direction on the targets that need to be met by 2025 under the pillars of education, leadership, jobs, and service delivery. And within our European roadmap, all of these four things are intertwined, but I want to focus in briefly on education in midwifery and the key actions. And as we've mentioned before, the education must align to that full scope of practice, that the midwife is able to practice on her own scope and to be able to lead the care for all women and babies who have no added complications. The education and practice must be based on evidence. And there must be mentoring within clinical placements. So students need to have education, not just in a university or in a college, but they need to be educated in practice placements so that they have hands-on, direct learning and teaching and training. And there also needs to be midwifery education in line with the international standards. These, however, are inextricably linked with leadership. And also with the other pillars, but leadership in particular, because we need strong, knowledgeable and empowered leaders. And that are all of you who are on this webinar today. We are all leaders and we need to be there to drive the change and help with delivering the implementation of this roadmap. So what are the key points for implementation? Well, we need to move towards developing and expanding bachelor level programs of education for midwifery. And that can be almost threatening in some areas where bachelor level has not been a tradition. However, what we need then to put in place is bridging programs so that those midwives who are already in service have an opportunity to come up to the bachelor, the degree level education, so that they are able to utilise the evidence base. And it's about the critical inquiry, the critical thinking. That is what degree level education gives to us, is that ability to critically analyse that evidence and to choose what is right for the service delivery within our area. We also need a regulatory process that actually reviews and approves the education programmes across each country so that it is consistent, as Maggie said, so that you have the same level of education, whether you're in a city or whether you're in a rural area. And the programmes need to be competency-based and aligned with the population health needs. I've already mentioned there has to be practice-based learning, hands-on, with qualified clinical midwifery mentors to support student learning. And the faculty needs to be developed so that midwives are taught by midwives, utilising the best pedagogical methods, technologies, clinical simulation and expertise. And we also need to be considering then working towards master's level programmes and PhD level programmes in midwifery as well as nursing. So, where do we start? Well, we have some great resources and tools that have been mentioned already. And this is one that I would urge you all to download. And this is from the WHO Global Office. It's Strengthening Quality Midwifery Education. And this document gives a really clear framework to guide the development and strengthening of midwifery education. And there is a 7-step action plan. And central to all that we do is women and newborns and improving the quality of care for them and preventing unnecessary death. And the first step in this action plan is to strengthen leadership and policy. Then we need to gather the evidence and the data within the country. And there are various tools to help with that. I'll come on to the MATE tool that Maggie mentioned in a moment. Then we need public engagement and advocacy, engaging with women in the country to see what they really want from their services. Then we prepare the educational institution and practice settings and develop the clinical mentors. Only then are we ready to move on and develop the curriculum and to strengthen the faculty. Then we educate the students, and we have to monitor, evaluate, and then adjust the programmes as necessary. So we act, we monitor, and we review. Now, as part of that second stage, which is to look at where we are now, our collaborating centre in Cardiff developed this midwifery assessment tool for education, MATE, and we developed this in collaboration with colleagues across Lithuania, the Czech Republic and Bulgaria. It's a self-assessment tool and it will inform discussions at your country level at early planning stage. And it asks, where are you now in terms of midwifery education? Where do you want to be? And how are you going to get there? Providing links to valuable resources. It belongs to those who use it within each country. And it's available in Russian as well. And I would suggest you contact your WHO country office if you need some support and direction in using MATE. The WHO also has some excellent resources online. There is the Interprofessional Midwifery Education Toolkit. I'm not going to go through it in detail today. There is also the Essential Childbirth Care course, and all of these resources are evidence-based and valuable resources to help us in developing midwifery education. I'm sure you're all aware of the WHO Global Community of Practice for Nursing and Midwifery. I would urge you to join this global network because we really can learn from one another in this network. There's also the International Confederation of Midwives, who have an amazing bank of resources to help and support us in developing both education for midwives and clinical standards. And this document is quite a new document in 2021. And this is a document specifically looking at practical and clinical experience within midwifery education programs. I would urge you to really look at this very important document, because that hands-on experience alongside the theoretical preparation and academic preparation of our students is so vital to midwifery practice. Just very briefly, here in the UK, we have the Nursing and Midwifery Council standards, and we launched in 2019 the Future Midwife standards. And these are evidence-based standards for pre-registration midwifery programs that are based on the Lancet series of midwifery, as published by Mary Renfrew et al. In 2014. These standards are really clear in that they are outcome focused. They have a set of proficiencies that are human rights focused. They look at what is really essential for women and families and their newborns. They really focus on midwifery-led care and the midwife as the lead professional and continuity of care and carer. And these are all elements that we are striving and working towards across the whole of the UK at the moment. But these may be really helpful standards for other people to look at in other countries that can support your own development. And just bearing in mind that 50% of the education in midwifery is clinically focused. It happens in the practice areas. So what are my messages to you today? Well, when I flew back on Saturday from Tajikistan, and it was nighttime when I landed in Istanbul airport, and I looked out of the window of the airplane, and what struck me was all the lights on the runway, these guiding lights. And it really hit home to me that pilots across the whole world have very clear standards, and they have guiding lights for how to bring that aeroplane down safely to land. And that every single pilot across the whole world is working to these standards of quality and safety. And I thought, you know, this is what we need for midwifery. We have global standards. What we must do is ensure that every single country is implementing them so that there is quality and safety to prevent the deaths of women and newborn babies. Let's make sure that we implement these guiding lights and get them shining brightly in every single country across the globe. And what better picture to end with? It's a very brief presentation from me, but I want to just share with you this beautiful photograph of one of our midwifery students. And this was her on her graduation day as a midwife, breastfeeding her baby. What better advert for a midwife? So Spasibo, thank you very much for the opportunity to share with you today. Karen, I think you're on mute.
I was just trying to find myself. Thank you so much, Grace Thomas, for this very inspiring presentation today on midwifery education. And also, you really do highlight what is included in the roadmap, and each of the guiding lights that you showed us are so meaningful to guide us. And in addition to each of those main areas, what's really significant in the European roadmap is that they're further defined with guidance to our member states of Europe. There are 53 member states in the European region, and they have adopted this plan. And so by bringing this plan back to them, we're showing them the guiding lights as well. But we need to show them where the guiding light is leading and be able to present that to them in order for them to come on board to implement the roadmap. Thank you so much for this wonderful presentation. And I'm just thinking as a bridge to the next presentation, you mentioned the complexity really of nursing and midwifery education is that half of midwifery and nursing education is theoretical, and half of it happens in clinical practice. And this is extremely complex because each of those areas really has its uniqueness, and we need to bring them together. And that's been a tremendous challenge for us, both in midwifery and in nursing, to bridge the gap between theory and practice. And that's what the next presentation is going to focus on. One of the guiding lights in the roadmap is that supporting collaborations across academia and clinical settings to ensure nursing and midwifery educators can facilitate up-to-date and experiential learning for their students. This is highlighted in the roadmap and is something that all of us know a lot about, both the ups and downs of. So our next speaker this morning, or this afternoon, is Dr. Katri Manninen. And she is from the Karolinska University Hospital and the Karolinska Institute in Stockholm. And she has developed a system or a model for student learning in clinical practice that may be a solution to bridging this gap. So the word is yours, Katri. Welcome to the webinar. And thank you for agreeing to have a presentation. The floor is yours.
Thank you, Karen, and good afternoon from Stockholm. Let me see, Walter. Yes, thank you. So thank you for inviting me to this webinar. It's a great honor for me to be here today and to talk about my passion in work life, namely learning in clinical practice. I'm Katri Manninen, and I'm a clinical teacher and lecturer and a nurse in the field of infectious diseases. And I'm also a researcher in medical education. Next. My journey within my research field began seriously in the year 2005 when I got an opportunity to become a part of a team launching and starting a clinical education ward. As a supervisor and clinical teacher, I have followed students' learning. As a nurse, I have listened to patients' appreciative comments on students. And as a colleague, I have followed supervisors working at the ward. And all these experiences awoke a need to understand students' learning in this context and to get an understanding that goes beyond the student evaluation surveys. So based on my experiences in and also pedagogical research, I strongly believe that today's students need to experience authenticity during their clinical education to become tomorrow's professionals. And educators need to understand the complexity of learning processes to be able to both give challenges and support for students. And furthermore, I also believe that patients should be involved as active participants in students' learning. And so my talk today is about these three concepts and how I relate them in learning in clinical practice. So what about learning? What is it? It is a complex phenomenon and it can be understood in different ways. I see learning as a transformative process, including active knowledge construction and meaning-making processes. Learning as a transformative process means that experiences are reflected on and interpreted in new or revised way and internalized, resulting in a new course of action. This process is complex and emotional, and it takes place partially outside of students' awareness, which means that they really need supportive learning environment. Learning is also seeking meaning, understanding things in a different way, and in fact, changing as a person. Let me see, the next one, please. Okay. So what about the clinical practice as learning environment? What are the special characteristics and how do they affect learning? Clinical practice is carried out in real workplaces and consists of encounters with patients, supervisors, other healthcare professionals, and peer students. The aim is to develop students' professional role, and students need to experience thoughts, emotions, and hands-on acting. They also need to actively construct and build up their own understanding, skills, and attitudes. The clinical settings are, however, unpredictable and not always ideal for learning. The main focus is on patient care, and education is often given a secondary role. And this results in challenges for both students and supervisors. Next slide, please. And from the perspective of healthcare employers, the clinical practice is about preparations for future profession and it needs to take place in workplaces that offer authentic experiences for the students. So what is this authenticity and why it is worth talking about? The concept of authenticity means that something is true, real, genuine, valid, and trustworthy, just to mention a few synonyms. So if the clinical practice is an authentic learning environment, shouldn't that be enough for learning to occur? Well, unfortunately, it's not that simple. Next slide, please. There are a lot of challenges in clinical practice. As we already have mentioned, it is a complex and messy world. There are organizational aspects such as busy workload, shortage of staff, how the supervision is organized, or is it organized at all? These are all challenges that we need to handle. And what can we do? How can we help our students in their learning? I think that what we need to do is that we need to create authentic learning environments that have an explicit pedagogical framework so we can focus on both patient care and education at the same time, and that these two parts are seen as equally important. Next. This means learning environments that are dedicated for both education and patient care, for example, clinical education ward. And I believe that these can be established in every type of clinical settings. And this on this slide, you can see an example of a pedagogical framework that is based on and applying transformative learning theory. And it means that patients are the base for students' learning. And the nursing care is carried out applying person and person-centered care. So also the learning becomes person and patient-centered. There is a team of supervisors guiding the students' learning and assuring the patient's safety. And the group of students offer a platform for peer learning. Next, please. So this type of clinical practice results in the experience of authenticity, which is in fact a prerequisite for student learning. In my research, I found that the experience of authenticity is crucial for student learning, and that it consists of two dimensions, an external and an internal dimension. Next one, please. The external dimension refers to being in real clinical settings and taking care of patients. And as I already mentioned, that you could easily think that that should be enough for learning to happen. And of course, certain learning occurs, but it is more of a superficial learning and learning to carry out tasks without understanding why they are done and without a holistic understanding of patient situation and the interplay of medical and nursing care. It can also result in that students feel that they do not learn anything new. They recognize the environment and they feel that there is nothing to learn for them. They can become more focused on supervisors rather than on patients. They are not able to see beyond what they feel as familiar. They only see the frame, but not what is inside it. Next one, please. While the internal dimension of authenticity refers to experience of belongingness, what students do really matter for patients' well-being. And for learning to occur in a deeper level, and for students to experience meaningful learning, they really need to experience also this internal dimension of authenticity. It means that they get a feeling of really making a contribution for patients' nursing care and being a valid member of a team taking care of patients. They make sense of their experiences and learning becomes meaningful. And their learning is a process of understanding the interplay between medical conditions and treatments and nursing care, and focusing on patients, not on supervisors. It's also about creating mutual relationships with the patients and learning from, through, and with the patients. Next one, please. To create this authenticity in learning, it is essential for the educators to understand the differences in students' learning processes and how they differ when the students are in the beginning and nearing the end of their education. In my research, I found that the first year students' learning process is usually quite straightforward. They are patient-centered. They have understanding of their own learning process. Their journey is, you could say that their journey is from not knowing to understanding. They understand and realize nursing process through encounters with their patients. They learn to observe, ask questions, to analyze, to make a plan, to carry it out, and to follow it up by taking care of their own patients with support. They also feel belongingness immediately. They feel that the patients trust on them and they collaborate with peers and supervisors. Whereas the final year students' learning process turned out to be more complex. The striking difference is that the final year students are more often self-centered and ambivalent. They long for independence, but this is transferred into depends on being guided and instructed. Their feeling of uncertainty also results objectifying patients, and all this forms a threshold for their learning. But when the students are guided back to the patients and they spend time with them, the students can overcome the threshold, and their learning process becomes more similar to first year students. I will now show you some quotes that illustrate these differences in learning process. Next, please. This first quote is from a first year student, and it's about the feeling of belongingness. And the students told me that her patient got seriously ill, had trouble of breathing. And she told me that I was told to stay with him. I hold his hand and he looked at me. My job was to calm him, and no one tried to take him away from me. I felt very important with the little knowledge I have. It was a horrible and a good experience at the same time. Next, please. This quote is from a final year student, and it illustrates the self-centeredness and ambivalence. And this is how the student thinks about the supervisor's role. I'm here to learn, and if you have noticed that I can't manage this, why don't you teach me without me having to ask for it? If you think that this is not good enough, I would like you to tell me. This is what you should practice, and this is how it should be done. Next, please. This quote is about overcoming the threshold, and the final year student tells about how she experienced a patient that was severe ill, and how by spending time with the patient and actually doing what nurses do, she got really an understanding the role of nursing. And she told me that we hold her hand and practically waited for her to die. Then she became a little bit angry and tried to scratch and pinch us. And we thought, damn it, now we will get rid of all wounds and everything. She had terrible wounds. All that was gone after 2 weeks. It's good to know, because now I know that nursing matters a lot. I didn't know. I thought that only ointments and injections would make a difference. Next, please. So what about the patient's role? I would say that by allowing and inviting patients to participate, they can actually be actively engaged in students' learning. And patients usually wish to become a part of students' learning. They really want to contribute. So what is needed is a patient and person-centered approach, and that the students create their own mutual relationships with patients. They spend time with them, and supervisors, they are there when needed. All this make patients feel safe and taken care of. And this results in learning as a joint action, and also learning relationships between students and patients, which is illustrated in following quotes. Next, please. And this is about patient participation. And the patient told me that they always ask if it's okay before they proceed with something. One day they will be responsible for everything, and it's good to have had the opportunity and the possibility to practice. Sometimes I even give them some advice on how they should do something and assist by holding things. Next, please. And this is about learning the relationship. And the patient told me that I learned today about my blood pressure. I thought that I had medicine for that, but it turned out I didn't. The students listen to me and they explain as well as they can and even better, that is different from other wards where the nurses and physicians think that because they know something, everybody knows it. So what about the supervisors and educators' role in this? I think that it is to be present, but stand behind, to give not only support, but also challenges. Supervisors help students, but they do not always give straight answers, but guide students to find the answers by discussing, questioning, and reflecting with them. And most importantly, they don't leave the students alone in their learning. Next, please. So, to conclude, the experience of authenticity is the core of student learning in clinical practice. Learning is not an easy and straightforward process. Students can experience feelings of chaos, too much responsibility, and different kind of negative feelings. It is important to acknowledge all these feelings and to verbalize them. And also what is needed is a pedagogical framework, patient and person-centeredness, belongingness, challenges, and support. Next one, please. Thank you for listening, and greetings from our clinical education ward here at Karolinska.
Thank you so much, Katri Maninen, for this excellent presentation that really highlights the complexity of learning to become a nurse, to become a midwife as well. That the complexity is about really learning or authentic learning, as you've explained to us now. And I think all of us who are on the call today, who are nurses and midwives, can identify with how difficult it is to learn nursing and midwifery and to have the clinical experience in which we really meet clinical faculty, nurses in the clinical field. And we know that that is a challenge today, given the nursing and midwifery shortage. So thank you so much for the research that you're doing, and also for highlighting these important elements of nursing and midwifery education. Thank you so much. Now we'll move on in the interest of time. Our next presenter is Ainagul Naurutsbayeva. And she is the Chief Expert of Nursing Development at the Ministry of Health in Kazakhstan. And Kazakhstan has significantly modernized nursing education over recent years. And Ainagul will now give us a brief introduction in English, and then she'll be speaking in Russian. So go ahead, Ainagul, looking forward to hearing from you. All the way from Kazakhstan. Welcome.
Good afternoon, dear colleagues. Let me thank the members of program committee and greet all participants, nurses, midwives, chief nursing officers, managers, and leaders of professional association, and of course, all those who are involved in teaching, training, educating the students both at school, universities, and clinical settings. I'm honored to take part in discussion of the modern trends and challenges in educating the future generations of nurses and midwives, and will share some latest development achieved in this area by the Ministry of Health of Kazakhstan Republic. Excuse me, my presentation.
Your presentation
Видно
is
мою
up,
презентацию?
Ainagul. I wonder if we could go back 2 slides. There we are. Okay.
Видно,
Now
да?
it's
Все.
first. Yeah, very good.
Окей. Медицинская служба — значимая часть системы здравоохранения. Она представлена...
So nursing care is a very important. It's a part and parcel of the health system. It should have a strong personnel or health resources. According to official statistics in Kazakhstan, the number of nurses makes up 121,000. Mid-level personnel, all in all, 188,000. And the number of nurses, we have 65,000 nurses in primary health care. So nursing has become one of the thrusts of the program and regulatory documents that are being developed in the Republic of Kazakhstan. According to the program, the health of the people, improvement of this health. So the reforming of the nursing and education, it has been underway since 1993. The Tucson, USA and Almaty, so we have become twin cities with regard to the training of new nurses or new generation of nurses. In Almaty, we opened up a pilot project for the higher nursing medical education. In 1994, there was a decision made to start the education of nurses with higher education. And then in we introduced the system of academic bachelor's degree and also applied bachelor's degree program. So this has been underway since 2014. In cooperation with our colleagues from Finland, we set up medical colleges for higher nursing educations from 2016 to 2020. 37 university colleges in Kazakhstan, so they have been put into practice. And in 2020, so we introduced a specialty nursing, and we started to train and educate specialists of doctors of philosophy, PhD program. And in 2010, Kazakhstan has become the 47th member country of the Bologna process. Kazakhstan consistently implements policies to unify national educational system with those of member states of Bologna agreements and process. This includes the development of higher education. So three-level degree system, bachelor's degree, master's degree, and PhD candidate. So ECTS system makes it possible to invest into the mobility of students and faculty of national degree and diploma recognition. So we have the graduates that are provided with diploma and the European supplement. So accreditation of degree programs and additional institutions to ensure the quality of education. As was mentioned already, we have a kind of a continuity in the training of nurses, starting from junior nurses or assistant nurses to senior nurses, then the bachelor's degree and the master's degree and PhD. We take into account each level of training. I mean, regular colleges and higher nursing education colleges. So they are part and parcel of the mid-level health personnel training. And we also use the European directives as the basis. Starting from the bottom level, let's say the period of study from 10 months. This is for junior nurse or general nurse, the time of education makes 2 years, 10 months. The next level, those who are associated with the applied bachelor's degree. You during the period of 5 years, we had 8,208 graduates. And the time duration of training makes up the 3.5 years and 1.5 years. Then the academic bachelor's degree. So it's the time of education for this specialty is undertaken in the higher medical institution. The time of education makes up 4 years. Since 2011, we had more than 200 graduates or alumni. The next level is a master's degree. So the training of such degree is done in 6 different educational institutions in Kazakhstan, and the master's degree. We had um, we had 159 graduates all in all during the period of 2 years. I would like to speak in greater detail about the postgraduate medical training. It's a Kazakh Finnish master's degree. Uh, so, uh, so the graduates of such courses, so they wear the hat of educators and teachers, and also they can wear the hat of the assistant chief physician in nursing. So we have in 2020, we launched this program, and the first graduates will happen this year. So the training of future mid-level personnel. 91 medical colleges are involved in this process. Of those, 24 are state-run and another 67 non-state ones. According to 2022, the total number of students made up 103,000 persons. And according to the state order, we have 23,000 persons and admission 35,000. So annually, we have this number of admitted students. Among the specialties, it's the general care, nursing, dentistry, and other subspecialties. Then using the bachelor's degree, we have all in all 9 educational institutions, higher educational institutions. So 9 universities, they provide academic bachelor's degree, and another 7 ones, they train nurses and master's degree. And 3 more ones, they provide education in nursing and PhD degree. As to the qualification of the applied bachelor's degree, so 6 months duration, and technical education 1 year, 6 months. We have all in all 400 places or vacancies for this. Then the bachelor's degree, so one can apply for admission after the secondary school if one has attended the technical education or vocational training. The period of training in 10 months. So depending on the initial level of education, the duration of future education is predetermined. And the doctor's degree is 3 years a training period of training. As of today, in the primary healthcare facilities, there is a post of general nurse. As a nurse of a new generation. She can see patients autonomously. She can also provide nursing care independently, then follow up of patients, training, and also home care. She can also improve health and prevent the diseases. She can conduct screening, vaccination, and a number of therapeutic interventions if need be. Since well, 2018, we have developed the clinical guidelines. And actually in 2020, we started this stepwise introduction of the guidelines for clinical. So they can treat cardiac failure, diabetes mellitus, prevention of cardiovascular diseases, medical rehabilitation. All in all, in Kazakhstan, we developed quite a number of different clinical nursing guidelines. They are all posted on the website, and one can always have a look at them. As of today, so in Kazakhstan, so we have a number of regulatory documents. One of the documents is the roadmap. So this roadmap is aimed at the training of nurses of new generation and improving their quality of training and education. The roadmap also reflects the implementation of certain tasks. So it has to do with the graduates of higher nursing education and regular colleges. They are awarded the certificates of the specialists and they have access to the clinical practice. And the high medical colleges, they are also part and parcel of this system. We also started to improve the requirements placed to the nurses. So we continue the work of the occupational nursing associations in order to make this profession more visible and make it more prestigious. As of now, well, so in all territories and the primary healthcare facilities, we introduce the position of the nurse. So today, thanks to the work done by the Ministry of Health in 20 regions of the country, we have the post of the coordinators or focal points of nursing in the healthcare system, and the main missions of their in their work is the coordination of the nursing in different parts of the region, introduction of new requirements and standards, and also dissemination of up-to-date information on nursing and improvement of nursing in the region, and also determine the needs of different territories in nurses. Within the framework of international cooperation, Kazakhstan attended the meeting of the focal points and chief nursing specialists in Israel during the regional committee meeting. And at that meeting, we met the representatives from the Central Asian region in the city of Bishkek. We approved the roadmap in support of improved health and well-being. So we have also developed the European roadmap, and today we're also developing an individual roadmap for the Central Asia in general. Many thanks to Maggie Langdens for this. In terms of midwifery, much is being done in this domain as well. And also Kazakh specialists also attended the 5th Congress of the Russian Association of Nurses. So many thanks to our colleagues. So with your permission, let me briefly comment. It's the launch of the certified training programs for new nurses specialists, and also stepwise implementation of clinical practice guidelines, nursing documentation, standard operating procedures, and also establishment also long-term results that we expect to obtain by 2025. It's the implementing of the new model of nursing throughout the country, and also development of the nursing science and nursing research. That's it. Thank you for your attention.
Thank you so much, Ainagul, for this wonderful presentation. And thank you for sharing the experience that your country has gone through in transforming nursing education. it really impresses me that it's taken Kazakhstan 30 years so far to transform nursing education and also, most importantly, nursing practice as well. And we can just imagine what this has cost in terms of political will within your Ministry of Health and within your government. So, and I'm also sure that it's cost a lot of blood, sweat, and tears, because change is very challenging on this broad dimension, as you've explained to us. And also congratulations that your first nurses to graduate with a PhD will happen later this year. And congratulations, this is really a proud achievement for Kazakhstan. Thank you once again for your presentation today. Now, from Kazakhstan, we would travel to Spain. Ainagul, can you take down your slides, please? Can we ask Ainagul to take down her slides? Thank you, Ainagul. Now, from Kazakhstan, we travel to Spain. Our next presentation is by Flores Vizcaya from the University of Alicante in Spain. She has been heavily involved in a European project called Qualment that is aimed to develop competencies of clinical mentors. And this also is a critical component of nursing and midwifery education. And that is, those nurses who are rooted in clinical practice also need to be highly competent in terms of what they are going to achieve when they have students in the clinical setting. So Flores, the floor is yours, please.
Thank you, thank you. I'm not sure if you are going to share my slides or I have to done it.
Do you have your slides, or shall I show them?
It's because I think that I have some problem with Zoom. Okay, it's okay.
Here are your slides.
Thank you. Thank you very much.
Go ahead.
I had a problem with Zoom. Please go next, please.
Oh, sorry.
Thank you. Good afternoon. I want to start the presentation by thanking the institution that organized this event for their invitation. It's a real pleasure for me. As a representative of the Qualment project partners, I will briefly introduce you to the free access project outputs that are published on the project website. Next, please. The Quality Mentoring Project for Development of Competent Nursing Students is co-founded by the Erasmus Plus program. And 5 institutions from 5 European countries are part of this consortium. Next, please. Next. Okay. The project outputs and deliverables are free access, and all of them are published on the project website. We would like to highlight the guideline of clinical nurse mentors, mentoring competence development, and the book of the course for mentors, advanced mentorship competence. All these resources are available in 24 languages for European nurses and midwives. They are the best results of our project that we want to share with nurses and midwives. Next, please. We have also offered the e-classroom of Qualment projects. It helps to mentors and clinical teachers to organize the course. We use Moodle as a learning management system, and we offer access to the course slides in 5 languages: English, Finnish, Lithuanian, Slovene, and Spanish. Next, please. The course framework was developed in the partners' collaboration and implemented in the intellectual output one of the Qualment project. Next, please. The Advanced Mentorship Competence course has 3 modules that perfectly articulate and complement each other. Module 1, Introduction to Mentorship in Nursing. Module 2, Cultural and Linguistical Diversity in the Mentoring of Nursing Students. And Module 3, Mentoring Competence in Assessment and Reflective Discussion. Next, please. A suite of teaching methods was selected for content and virtual learning. This slide presents examples such as lectures, brainstorming, teamwork, group discussion, distant learning, and quiz. The images on the right are examples of teamwork exercises and slides for lectures or distance learning. Next, please. We have used didactic materials as the book, Advanced Mentorship Competence, the guideline on clinical nurse mentors mentoring competence development, the Directive 2013, the EFN competency framework, articles, and other resources. Next, please. Finally, we want to invite you to visit our Qualment project website, where you can learn much more than in this little bit presentation. And of course, thank you to all of you for your attention.
Thank you so much, Flores, for this presentation of the Qualment project. Many of us have heard about the Qualment project, but to have this very brief, as you say, presentation today is really important as part of the total picture that we're looking at, because the Qualment project, of course, is important to support the mentor role in clinical practice, where nurses and midwives spend half of their clinical nursing educational training, and midwives as well. And that's a lot of time that we use in clinical practice during our education. So it's really critical that the role of the mentor is lifted up. And I really do believe that the Qualment project can really start to drive an awareness across Europe of the important role. And it's especially important now because of the situation of the nursing shortage, the midwifery shortage in clinical practice, which means that nurses and midwives are really pressed for time in clinical practice. So education is definitely a very important part of their work in many, if not most, clinical settings. So thank you very much for highlighting the Qualment project today. So we will move on then to have our discussion. We have a little bit reduced time for the discussion, but I think we'll at least be able to start it, and then you can all continue to reflect on what we've been discussing here today. We've heard presentations today that highlight different aspects of the European roadmap for nursing and midwifery. And now the roadmap was adopted by all 53 countries in the European region, as we've mentioned already. But what's happening at the national level? In order to really implement the roadmap, we need to have awareness. And probably we need to have motivators. We need to have drivers in each of our countries. Probably the implementation will not happen if nurses and midwives are not strongly engaged in reminding their governments that they have pledged to work on the roadmap and to develop nursing and midwifery. So we invite you all to reflect on this. What is happening in your country? How are nurses and midwives engaged in your country when it comes to motivating your government and being in contact with your government? Are the focal points, is also a term that we've heard used today, the focal points for nursing and midwifery in the individual countries. Now, national nurses and midwives associations are critical stakeholders to be engaged in the education of the next generation of nurses and midwives. The very purpose of this webinar is to reflect on the role of the National Nurses and Midwives Associations in the implementation of the global strategic directions and the roadmap for our own European region of WHO. Now, we've invited 4 panelists here today, and we're asking them 4 questions. Who is driving the process in your country? How are national nurses and midwives associations in the region engaged in dialogue with the ministries and education and health? And this shows the complexity, because we're not just dealing with one ministry in the government, but probably work with 2, both education and the Ministry of Health. And how can your NNA or your National Midwives or National Nurses Association, as a key stakeholder, increase your impact on health and educational policies? Now, these are the 3 questions we've asked our panelists, and our panelists are first Benedikta Molnes. I'll call on you in just one moment. Valentina Sarkisova, she's the president of the Russian Nurses Association. Silvia Amann-Fichte is president of the Swiss Midwifery Education Board. And I really do apologize that Silvia is not the president of the Swiss Midwifery Association, as it says in the program. I apologize for that mistake. She is the president of the Swiss Midwifery Education Board. And finally, we asked Hannah Charlotte Sheldrup to comment, participate in the panel, and she is president of the midwifery group in the Norwegian Nurses Organization. So going back to Benedikta. Now, Benedikta is not from a National Nurses and Midwives Association. She's actually president of the European Nursing Students Association. And of course, students are a very important stakeholder when it comes to nursing and midwifery education. So Benedikta, if you could just unmute yourself and turn your camera on. There you are, Benedikta. Hi, good morning. I was spoken to Benedikta yesterday evening as she was preparing to talk with us today, and I'm really looking forward to hear what you have to say, Benedikta. Wonderful.
I'm excited as well. Thank you. I guess I can just begin. I know there is a time-sensitive period now. So European Nursing Student Association represents nursing students from countries all over Europe. Our members are the national nursing organizations and their members. Our present board consists of 7 active nursing students and early career nurses who are engaged in their own organization and student life. European Nursing Student Association has been involved in the development of the roadmap. We are here today to make sure that the students' voices are heard. We have also earlier attended the WHO Euro Regional Committee meeting in Copenhagen. We are participating in the Forum for Youth led by WHO Europe and are presently involved in the project Nursing and Midwifery Global Community of Practice, an online forum for nurses and midwives around the world that facilitates collaboration and networking with each other and stakeholders. ENSA, what we call ourselves, European Nursing Student Association, also contributes to the Immune Project, a project with the aim to educate and promote about the importance of immunization about vaccine preventative diseases. When it comes to education, the interest of European Nursing Student Association is that the clinical practice is qualitative because it needs to be in order to educate great nurses, trustworthy nurses, safe nurses. Because the period that nursing students are in practice is a time that they can learn the many important skills that are required by them when they are a nurse. The students are in a great need of a guidance that makes them become the great nurses they aim to be. Sadly, because of different reasons, clinical practice for nursing students can be anything but qualitative. The nursing shortage affects our students negatively because the practical training sometimes does not occur for students, and that shouldn't happen. Nursing training in practice needs to be non-negotiable. And even when there is practical training, other times that it isn't done with a high quality because it is done in a hurry, there aren't enough resources or enough people to be there for the time that is needed. The challenges we meet as students are that the quality of the clinical practice has declined due to the nursing shortage. It has affected us with how much we actually learn during a course, and then it affects how secure we are as nurses when the course is finished. If I can highlight 2 points with this speech, will it be this? Firstly, the nursing degrees all around Europe needs to be comparable and be qualitative, especially when it comes to the clinical practice. Secondly, is it important that there is a nursing student organization in all countries, and that the nurses and midwives associations work together with the student associations to involve them when you go to the ministry with courses about education and health and career. We, the students, want to engage. So my very last message is engage with us.
Thank you so much, Benedicta. That was a very clear message from the students. Thank you so much. And when I think about it, nursing students who graduate in 2023 will probably have a career of 40 years. And that brings us all the way out to 2063, long past my term of life, actually. So it's really critical that the investment that we make today is going to have a long-term impact on the quality of healthcare in Europe. So thank you very much for your engagement with us. And I really do encourage everyone who's on the call today to really do engage with nursing students. They are the voice of nursing tomorrow and our leaders of tomorrow. Thank you, Benedicta.
Thank you so much, Karen. It's a pleasure engaging with you as well. We enjoy it very much.
Thank you. And our next speaker is Valentina Sarkisova. She's president of the Russian Nurses Association and also former president of EFNNMA. For 9 years, she was president of EFNNMA, and before that, she was vice president for many years as well. So we know you well, Valentina. We're so happy that you're with us today. The floor is yours. Who's driving the process in Russia today?
Дорогая Карен, дорогие уважаемые коллеги, большое вам спасибо за прекрасный
Dear Karen, dear colleagues, thank you for this excellent, this brilliant webinar, because the subject matter is highly relevant, highly helpful and meaningful, because exactly right now, we have just got down to developing the roadmap. So today's point, the experience of other countries will be highly helpful. And I'm very glad to see all of you here, of course. Well, what I'd like to tell you about nursing education in Russia. Well, currently it's a multi-tier system, because in the 1990s, Russia saw the development of university education for nurses and midwives in Russia. And of course, the regional associations were involved quite significantly there in that work. After 2 years of study, the association could secure that midwives and nurses, we extended for 2 years education, and also more in-depth education was provided to senior nurses to work as leaders. But this ongoing reform, well, in 2016, the system was a bit modified, because we were aware that in 2015, for instance, we had only 82,000 students. And we're building up this number in an ongoing basis, because we are short of many HR in midwives and nurses. And right now, more than 50% growth we can see among our students. Of course, our great task is to work with students, well, to be their mentors and preceptors in the preclinical setting. And we do understand that nurses should give a high focus to this issue. Presently, the share of the graduates has grown who do not come after graduation to the health sector. And unfortunately, the Ministry of Health is very concerned about that. And we have now a new project of students, college student reduction, and shifting the stress on improved qualifications of professionals, that is, postgraduate studies. And I believe we'll certainly find a common understanding. Well, of course, we were very dissatisfied with the system, and we managed to extend up to 2.5 years for midwives to learn. But I think that the continued education of professional nurses will also have a positive impact. In our country, well, education is dealt with by the Ministry of Health, Ministry of Education, and also the Ministry of Enlightenment. So it's rather hard to perform for us, because financing is most varied. There are many channels, regional, federal, and so on. Nonetheless, we have after our Congress, we defined in our resolution. Well, the Vice Minister also made a presentation there and designated all the issues that are on the agenda currently. And we were aware that all of us, and we understood that we have a very serious work ahead. We had drafted actually, that large size resolution where included all our 10 points. And I believe starting this year, hand in hand with the Ministry of Health, we'll develop the roadmap and also the policy or concept of nursing. And of course, the associations are involved in all these points, development everywhere. During the COVID pandemic, we began to work closely with the regional associations, and we spent we carried out many events, learning events. They have an ongoing basis. In fact, every day we're working on that. So we have noted now and mark the 1000th anniversary of the courses. We have strengthened our work. We have a very good project, our field schools, where nurses, excellent instructors, go to the regions and spend the 2-year, 3-year workshops involving many professional nurses, midwives, so that they wouldn't come to the capital, but our experts go there to the fields, and we have received quite good feedback. And instead of 20 schools, 10 schools, we have now 18 schools. Two more have been added. So our nurses are quite proactive also in accreditation. That is, the learning process goes hand in hand with the associations. Regional associations. We have developed some professional standards, which are being now approved by the Ministry of Health. They have passed the stage of approvals by the Ministry of Labor. Now they are the Ministry of Health. So we are aware that as of now, we have a lot of work ahead, and we do understand that we should necessarily work closely with the students and our regional associations where we have colleges. This work is going quite proactively. So we are drafting new documents right now. We have mentorship, preceptorship, and I think we'll keep in mind the wishes of our students. And I believe this work will be improved onwards. And we'll do our best so that our mentors, preceptors, preclinically and also clinically would also be involved in this process. So in a nutshell, that's all I wanted to deliver to answer questions. If there are questions from your side, I'm at your service.
Thank you very much, Valentina. That's very interesting to hear what's happening in the area of nursing and midwifery education in the Russian Federation. And we're very much aware that the Russian Federation is very broad, extending from the western part of the region and all the way over to Vladivostok. So there's a lot of variation across Russia as well. And we're very much aware as well that the financial situation is very hard pressed in Russia at the present time. And we do wish you every bit of luck with securing finance for nursing and midwifery education moving forward, so that you're able to maintain the level of quality education for nurses and midwives, and also that you are really working very hard from the Nurses Association to support nurses in the clinical field. That's extremely important for you and for your members, and also reminding the ministry continuously of the international standards for quality education. So thank you so much for your contribution here today. Thank you. Now we'll move on, and we have Sylvia Amman Fichter with us here from Switzerland. And I will just give you the floor, Sylvia, and following your presentation, we'll hear from Hanne Charlotte Schjelderup from Norway. Go ahead, Sylvia.
Thank you very much, Karen. I will also respond to the question on who is driving the process in our country, in Switzerland. And unfortunately, as in many other countries, the dialogue with the Ministry of Health and Education is very challenging, as midwifery as a profession is still not fully recognized in the healthcare system as lead primary caregiver. As you said before, we are unfortunately more seen as implementers than as initiators. And of course, we absolutely want to change this. That means that the drive for this change, they mostly come from the educational institutes, as the main focus of the associations or the federation is practice. For these changes, however, it doesn't matter so much in Switzerland where the drive comes from, because we are a really small country. And within the midwifery profession, we all work really strongly together, if it is midwifery practice, education, or research. We all work together. In this, the Midwifery Education Board, which I have the presidents, that means this is the representation of the 4 educational institutes in Switzerland who educate midwifery on bachelor and master level. We actually started systematically last October, systematically working through this WHO Euro roadmap, and we think it's an absolute fabulous tool for us. First of all, as you also already said, Karen, before, it gives us the possibility to raise awareness of what has been achieved in our country and what needs to be achieved. It gives us the possibility to take the goals which are within the roadmap and to take them, to change them into the national context and the reality. So we set realistic goals for our country on a long and short term level. This means that once we have elaborated that, that gives us a strategic tool, and a constructive and strategic tool, we can then go to our Ministry of Health with something which is really well worked through. And the next times, of course, we have to set then priorities, because we can't do all at the same time as we have limited resources. We will set up working groups and adapt along as we go. But all of all, thank you very much for this incredibly important tool you worked out, which we really appreciate, highly appreciate. Thank you.
And thank you, Sylvia, for your comments and to inform us about what's happening in Switzerland, and who's driving the process. It really is then from the academics and from the university environment in Switzerland, as you've said, but raising the awareness within the ministry and holding them accountable for implementing the strategic directions and the roadmap itself are really quite critical. It might be a bit difficult or challenging really in Switzerland, since you are a federation of different cantons. I understand that. And this is the importance of having a national plan that's particular for your context and for your governance structure in Switzerland, and to be able to speak with your politicians and your ministries. Of course, that's very critical. But good luck in that. I wish I could have heard that you had a national chief government midwifery officer, but I know that Switzerland does not. And we all have to work hard to get the national support of the leadership. And that's why Grace Thomas raised the issue that the leadership aspect and the leadership element is critical when we're talking about education, because we need the leadership at the national level to really drive the process. Okay, that's a comment from my side. And now we'll go over to Hanne-Charlotte to hear what Hannah has to say, and how you're working with the roadmap and with nursing and midwifery education, excuse me, in Norway. So go ahead, Hanne-Charlotte.
Thank you, Karen. Hello, I'm Hanne-Charlotte Schjelderup, and I'm the president of the Midwife Association in the Norwegian Nurses Organization. We believe that the key challenges of providing quality education lies in the system of bachelors in nursing, followed by a master's degree in midwifery. Competent caregivers give increased patient safety. Our association and the Norwegian Nurse Organization have been very active lobbyists and stakeholders for making the midwifery master's degree a reality in Norway. This opened doors for research within midwifery, and we've seen an increase in professors and PhDs within midwifery after the master's degree was in place. Our association can then coordinate and cooperate with the researchers and midwives all over the country to improve and create guidelines in our field and pinpoint the challenges we need to overcome. We've been working hard to get a chief officer midwife in place in Norway, because we believe that this role, in combination with active associations, is key to successfully implement the GSDNM and make sure that we are more sustainable rigged financially and securing the access to educated midwives in the future. We are headed in the right direction with baby steps, but changes takes time and willingness. The key to speak the language of the decisions maker is by numbers and statistics, and if they don't exist, we have to make them ourselves. We have, by strategic work, got to the position that we as an association get invited to participate in government processes to improve care and education. Strategic work involving active use of media and social media, quest backs to our members, and close cooperation between nurses and midwives within the organization, especially our public health nurses and pediatric nurses. Our association also have a good strategic plan for recruiting new members, and we got 80% more members this last years. The Midwifery Association have a unique role as the voice for women's health and for quality pre, peri, and postpartum care across the continuum. In Norway, we focus on collaboration with women organizations and other stakeholders when mutually beneficial. The role of our union stewards of the labor union is also very important. Knowledgeable midwives who participate in the debate are important to influence the public and employers. As key stakeholders, the association must deliver the facts and give possible solutions to increase our impact on health and educational policies. Right now, for us, this means we as an association have been part of the development of new guidelines for midwifery education. We are working for a double education capacity for midwives, and we have soon persuaded our health minister to change the finance system for birth care and move towards a continuity model of care in Norway. Due to the lack of midwives, we accepted that our students now can have 40 births in the line with European Union's regulations and not 50 as before. We also agreed that the students can apply directly after nursing bachelor to midwifery master. The financial system are important because they determine the frames of education and practice. I'm looking forward to this discussion. Thank you for your time.
And thank you, Hanna Charlotte, for raising the important role that the Midwifery Association, the nurse, and it's the same, of course, for the Nurses Association, to be lobbyists, to work very closely, to have an impact on the decision-making processes. And as you mentioned, the role of the Chief Midwifery Officer, the Chief Nursing Officer, is really critical for implementation, successful implementation of the roadmap in any country. And we're really looking forward to seeing some type of or an increase in the number of roadmaps across Europe for this country or that country. And I think that Aina Gould from Kazakhstan really showed that they had established a roadmap many years ago, and it really has been successful in transforming nursing and midwifery education in Kazakhstan. And this is a kind of strategic process that we need to see across Europe. And I think you've showed us, Hanna, and Sylvia has showed us that really working systematically, strategically with the decision makers who really decide that it's really important. They don't know nursing, they don't know midwifery. And so what we bring to the table is so important to have an impact and to inform them so they can make informed decisions what that would be the best for our individual countries. And so we're looking forward to see more and more roadmaps for each of the countries across Europe. And I wish all of us present at this webinar really to engage with your national midwifery, your national nurses associations, to see how are we going to really have an impact in the Ministry of Health, in the Ministry of Education, to make this roadmap a reality and to implement it locally in each of our countries. And with that, my final comment, I will turn the floor back to Merve Jokinen, who will wind up the webinar for us today. Thank you.
Thank you so much.
Go ahead.
Thank you so much, Karen. And I only just say a few words, but actually they are very much a repeat what Karen just said. Thank you so much, everyone. The excellent speakers we had and a lovely representation of the associations in the panel. And also, of course, everybody who joined the webinar. I saw so many numbers coming up and going off. I know people are very busy in their works environments if they were joining us, but I hope you also enjoyed, because that's what we are here for. We are to learn from each other. And I think I had a few messages from each speaker and also the panel. I think Maggie and Grace kicked it off perfectly, saying that by using the framework of the roadmap, we will be able to be more aligned and harmonized. I mean, we got this excellent document that your governments have signed into to support and have adopted. So let's use it as our framework and adapt it to your own country situation. And also, Grace reminded us that there's plenty of resources out there. You can find this information. You don't need to reinvent the cycle. Actually use what is available on the internet, because we now can share this information so much quickly. And hopefully it will be translated to other languages that are available. And then, of course, we followed by Katri, which gives us the reality of delivering clinical practice learning and reaching the encompassing nursing competencies actually in a clinical practice. And Ainakul, I thought actually that your progress was much quicker than 30 years that Karen said. I calculated 17 years. I mean, absolutely fantastic achievement. 17 years to actually setting new programs and changing the skilled workforce. And most importantly, learning from each other, using Finland, twinning with another country. You don't need to be there alone. If somebody has taken those steps, join them on those steps and take your road forward. And also, finally, I think Flores brought us the information on ensuring how the quality of being a clinical mentor is essential for clinical learning. And again, having a training course, we often say training the trainers, but I think mentoring mentors is different. This is all about knowledge as much as about the practical skills and supervising and nurturing the future students. And the panel members, thank you for the inspiring session. And of course, that was what we are looking for in EFNNMA. We want the association, turn back the historical clock I mentioned earlier, associations where the leaders of setting the standards of the profession education. It may have gone off our hands, but we can get it back. We don't have to take it all on our shoulders, but we can work with the government. We can work with the Department of Education and Health and the ministers. And finally, thank you, Karen. You're such a professional moderator. I absolutely enjoy listening to you and keeping the seminar and the webinar moving. So hope you enjoyed it as much as I have. And I just want to remind you, we have a 4th session actually in May, 10th of May. So do keep your eye open for the Twitter and social media and EFNNMA website for the registration link and join us in May. So thank you very much, everyone, and enjoy the rest of your day.
Thank you, Merve. Bye, everyone.
Bye-bye.
Thank you for your participation.
Thank you very much.
Bye.
Goodbye.
Thank you. Bye-bye.
Nice to meet you.
Nice to meet you as well.